Welcome. I'm Ganveer Baveja, the EVP here at CSDefend, a suite of services from Convert Security Solutions. Those of you who are not familiar with Convert Security Solutions, we've been providing cybersecurity solutions for hundreds of thousands of users, plus billions of dollars worth of assets. I have a pleasure to introduce two of the industry thought leaders. First is Major General Dr. Granger, a recognized medical doctor and a cybersecurity expert. And second is Chip Block, who's the Chief Solutions Architect for CSS. He works extensively in the areas of cyber research, development, and operations. Chip, I'll let you take it from here.
Thank you, Ganveer. So most of us are all familiar with the growing world around cybersecurity incidents. But today we're going to address a specific area. Those incidents related to rural hospitals and small healthcare providers. Okay. Recent studies have indicated that over 490 attacks have occurred against hospitals just this year. 15 rural hospitals in Alabama, Colorado, and California were attacked in a 60-day period. At least 2 providers this year are shutting their doors permanently after being attacked. Not only is this having an economic impact on these companies, it is directly affecting patient care. A recent National Science Foundation funded study found a correlation of 25 to 30 deaths per 10,000 patients could be directly attributed to cyber attacks and the actions taken after the attack. So what are some of the issues related to small and rural hospital security programs? We are now going to have a conversation. We're very honored to have Dr. Granger with us. He's a recognized leader, not only as a practicing physician, but he's also a certified cybersecurity board member on a number of major health organizations. What we're going to do now is just kind of have a conversation around the impact cybersecurity is having on small and rural hospitals, and specifically from a patient safety and compliance perspective. Welcome, Dr. Granger.
Appreciate it. Thank you.
So let's start with the first question. What are some of the unique challenges facing rural hospitals that are different than other organizations?
Well, let me say this. If you look at the history of rural hospitals, they were established what we call a critical access hospital legislation put in by the federal government in 1997. And why did we establish those? Because we want to have, for rural America, we want to have a certain amount of distance between the major medical centers as well as rural hospitals. We want to create that distance from time to save life, limb, and eyesight. Here are some of the challenges. Number one, there's difficulty a lot of time in recruiting providers there. Number two, there's difficulty a lot of time instead of having a proper transportation. And number three, there's a lack of what we call, not beyond HIPAA, good cybersecurity hygiene, because it requires investing so many assets, but a lot of them think they can't afford. Let me give you one quick example. If you look at the national healthcare system in the United Kingdom, most people in the United Kingdom being the big cities, London, the places around the major cities, etc., or Oxford or Cambridge. But a good part of the United Kingdom is rural. In about 2017, they got hit with what are called a WannaCry, safe cyber or ransomware. In the process of doing that, they had to stop and divert ambulances, stop emergency procedures, stop routine health care, as well as try to go back to paper. And that in itself had a huge impact on patients being able to get the right care they need at the right time in the right location. So just a few of the challenges that also face rural hospitals in America.
So that brings us to a kind of a related activity, which is, how does this directly affect patient safety and patient care? People tend to think of cybersecurity as something the IT people are dealing with, but what are some of the impacts this is having directly on patients?
Let me put it very simple. I call it in terms of the acronym P's. Number one, the first P is the people, which include the staff, the patients that have to operate in hospital systems. This day and time, we're almost 100% dependent on electronic means of providing care. Not just documenting the electronic healthcare record, but also from a HIPAA standpoint, laboratory standpoint, the machines in the hospital devices, they're all connected or interconnected. So from a patient safety standpoint, if somebody get into the system, they can manipulate laboratory data, x-ray data, still critical patient information that can have a huge impact on changing data, could lead to bad outcomes, quality and safety. In some cases, as you stated earlier, Chip, death. So those are some of the things that directly affect patient safety and patient outcomes.
Very good. So you mentioned before that hospitals are also being faced with compliance capabilities and requirements. What are some of those that are that they're being addressing?
Okay, most small and rural hospitals financially depend on the Center for Medicare and Medicaid, as I stated earlier, under the critical access hospitals. They get paid a little bit more. They have to have a minimum number of beds, etc. So that's one of the main compliance they have to fulfill that. But in addition to that, if something happened to their infrastructure through a cyber attack, they cannot fulfill all those requirements by Center for Medicare and Medicaid and state Medicaid programs. And sometimes some private, large and small insurers, they must fulfill certain requirements put out by the Health and Human Services. If you look at the 7 elements of compliance, can they monitor what they're doing? Can they check for patient safety? Can they identify and validate labs? Can they identify that the procedure takes place from that standpoint, operating procedure? Can they identify that patient actually received care, somebody go and manipulate the data? So those are just some of the compliance issues that are faced by small and rural hospitals. And sometimes these small and rural hospitals, they have ones and twos. There's sometimes one individual doing several of the compliance requirements based on good hospital compliance from quality, outcome, safety, and most important, trying to prevent some bad things from happening.
Very good. Now you mentioned this before. You know, we have when most people think of cybersecurity, they equate it to their own office environments, or they think of things such as their personal email or whatever. Or when they think of healthcare, they think of electronic health records. You mentioned before, but what are some of the other systems that are out there that directly impact clinical capabilities that fall under this challenge of rural hospitals and cybersecurity?
You know, several years ago, the federal government put in what is called the Health Information Exchange System. The federal government gave states to connect and share data among not only large hospitals, from small to large, and sometimes even clinics. And now in the process, when you look at small hospital system, most of the time they're referring to some large system. And that referral takes place, the data being transferred, not only from an electronic standpoint, but also we're bringing on telehealth, telemedicine. We're having monitoring devices at home, remote monitoring. All those things beyond the electronic healthcare record will impact the clinical capabilities at a small hospital, because they're trying to connect with a large hospital to exchange data, to also change things like x-rays, other type of procedure laboratory data. If that is attacked, they cannot transmit that information, even though they're transmitting the patient from getting to the best possible care in the most efficient and effective time. Those are some of the overall clinical impacts that we see today, as well as if we don't get the right hygiene in place, we'll see in the future.
Very good. So I'm now going to talk a little bit about how this translates to the information security team. As Dr. Granger just detailed, this is a very complex situation, right? We're going to have to address how does the information security teams on the ground at these hospitals have to, what are some of the challenges facing them? If you read most of the guidance that's out there for cybersecurity today, you find it's fairly straightforward. The answer is to spend a bunch of money and hire a bunch of people, right? Whether the solution is to implement the NIST cybersecurity framework, establish a risk program, putting capabilities in place to become HIPAA compliant. All of these requirements all have costs. They put stress on both the systems and the capabilities, but they require technology implementations. There are a lot of things that are driving that. Not only that, they require people. Some recent studies have said there's 4 million cybersecurity jobs around that are unfilled around the world today. It is highly challenging to find staff who can perform the required activities for a good cyber program. So you've got a number of challenges here, which is both the staff and the budget to buy the equipment and capabilities that you need. Not only that, knowing what to spend the money becomes a great challenge. Just spending money doesn't necessarily resolve the problem of a good cyber program. Then the other issue is the complexities with the hospital. As Dr. Granger just talked about, you're dealing with medical devices such as infusion pumps and MRI machines. Now you have the growth of telehealth that is out there. You have the requirements of sharing data. You even are getting conflicts between the need for cyber and the growing capability. As an example, because of the opioid crisis, has been the move to require all prescriptions for opioids to be electronically generated. There's no longer the capability to do so on paper. Well, if you have if you don't have the ability because of a ransomware system to actually generate electronic prescriptions, it is a direct and immediate impact on patients. So there's a very complex environment that is out there, that is going out there. And this is directly impacting patient safety. One of the things that we've talked about is the distance and time and distance challenges. And how do we address those? Unlike a big city, you can't just move the patients down the street. On some of the recent attacks, one of the things that we got very involved is some discussions about the patients who were going from hospital A to B. We're talking 2 hours away. It is quite a challenge. There's also another challenge for the IT staff. Last year, for those who are not familiar with the orange worm virus, it started showing up in MRI machines. As we talked to some hospitals that we're connected with, it turns out the MRI machines there shows up every Wednesday in a truck. And the conversation with the IT team was, what are the firewall and protections between mobile capabilities that are showing up once a week? So there are challenges there. So there are a lot of these things facing the challenges of providing both patient safety and compliant capability. So so how do we address this need to provide the improved cybersecurity, but at the same time at a price that aligns with the increasing cost pressures to small and mid-sized business? Gunvir, I think you have a way to address these challenges.
Thank you, Chip. So, how do we address these issues as CSDefend? We provide a managed services capability, so you don't need to hire the people or buy the systems that you have to maintain and then keep it up and running and then constantly changing because new threats arise. So as Dr. Granger, as well as Chip mentioned, today's threats and compliance guidelines require healthcare organizations of all sizes to collect, correlate, analyze security information of all systems, including IT, to ensure rapid detection and remediation. So our comprehensive cybersecurity monitoring and compliance solution gives you this capability for continuous monitoring of your entire network to detect and respond to hidden cybersecurity threats. So, talking about compliance, we can provide many types of compliance, some of which are HIPAA, NIST, and PCI compliance. So CSDefend overall provides monitoring for all of your critical devices. Our solution is real-time analysis and correlation, 24/7, 365. And then we give you a customized report. We just don't give you a 200-page report, and for you to navigate. We have one-on-one consulting on a monthly basis to help you navigate and remediate all of your critical issues. So, what are some of the benefits? How are these benefits and how do we do it? We provide a low-cost solution. We provide immediate detection. We help with risk reduction. We help you with remediation, and we help you with compliance. So, how do we do this? We have taken the cutting-edge technology and solutions that we provide to large enterprise customers and government agencies and packaged it in a managed solutions. This allows us to leverage the technology and people across the rural hospital environment. What are some of the features that we have? As I mentioned, we have 24/7 monitoring. We help you with compliance reports. We help you with security awareness training, among others. And our approach, what is our approach in helping you do this? We help you detect that threat. What is that threat, consisting of malware or web traffic? We help you respond to it, and then we make sure that you're complying with all of your regulations. So what are some of the common threats that we detect? Some of which are hacker reconnaissance, policy violations, device vulnerability, and foreign counterattacks, among others. So what do you get once we start doing the monitoring and provide you the service? We develop a custom dashboard for each of our customers, so your technical staff can review it at the high level or dig down into the details of the vulnerabilities. If your team does not have the time or resources, we can provide a high-level summary as well as a process of remediating these vulnerabilities, obviously in the order of importance. As an added benefit, as I mentioned earlier, we provide customized reports to your team. It's not just a 200-page report. We set up a call and we go through each item and we make our recommendations. So all of our plans, we begin with a complimentary security assessment. We understand you don't want to dive into a subscription, so we take a consultative approach in really understanding your needs and then tailoring it to our offering. We have 3 levels of offering, which is basic, professional, and enterprise. And the basic is sort of the most affordable thing. So why are we different? CSDefend addresses the unique challenges facing the rural and mid-sized hospitals. We have on our board Dr. Elder, we have Chip, who's the chief architect, which understands not just the cyber posture, but as well as the risk related to the hospital environment. You can contact us for a free security assessment. And now I think we can dive into the question and answers of it. Let's see if we have any questions that have come up. All right, I think we have a couple. How do I know if I'm part of a critical access hospital? Dr. Granger, would you be able to answer that? How does that impact us, being a critical access hospital?
Let me say this, as a critical access hospitals, and those of you involved with critical access, as I stated earlier, they are put in place for time and distance, and some of our critical access hospitals support some of our major industrial areas in the country, whether it be a farming community, a steel mill community, poultry community, cattle, you name it. If that hospital is attacked, then that hospital is put at a standstill, because now most of these critical access hospitals have some form of electronic transmission. If you shut them down, they don't have the backup of redundancy, and for them to pull out paper, that can be difficult. They'll have to divert most, if not all, their patients to other facilities, in most cases, at least an hour away based on the rules of critical access, time, and distance. That's the impact it could have. And I will tell you, the Journal of the American Medical Association did a survey of physicians about a year or so ago, and the number one concern they had when it came down to patient safety, they said, well, look, with cybersecurity, my clinic, the hospital I'm working with now, and most providers are being hired by healthcare system. They said that getting a cyber attack and bringing what they have to do to take care of a patient to a halt, they'll have impact on life, limb, and eyesight. Thank you, Gambir.
All right. I think we have a couple more questions. I think, Chip, this may be for you. Who do I call if I get attacked?
Okay. Yeah, this actually is a really good question in the sense that given the pace of attacks lately, actually the answer here is quite simply is FBI, and I would tell all of the people on the call, if you do not know who your local FBI representative is, the cybersecurity realm, you need to go look that up, or if you want to drop us an email, I can help. We can help with that, that is the first call. The second thing I would recommend is not familiar with the InfraGard organization within the FBI, that is there. They also have recently started several panels. I know there was one yesterday in Kansas City where they are actually reaching out to the rural hospitals. Now, all of this is stuff, if we can kind of provide you, if you drop us an email, I can get on the phone and give you some more detail, but that would be the first place that you would want to go.
All right. Thank you, Chip.
I want to say to our colleagues on this call is that getting an assessment and having remote protection, like we've done in many places in healthcare, is probably the best and safest thing to do. If you cannot do it alone, then talk to other rural hospitals, either in your state or county or geographical location, and consider developing what they call a consortium, where you all come together. You take something like CSDefend and say, we're going to go together, and can you support us remotely? And we all sort of share an overall assessment and cost of doing that. That has been very effective in some of the industries where they're small, whether it be small colleges, universities, or small businesses. They go together and they do a consolidation or a consortium, and they share in the cost and responsibility. At the same time, they're not necessarily sharing in their data, but their data is being protected. In some cases, sharing in data, you want both of you as part of your consortium, going from a large to a small or several small hospitals and clinics. You're sharing a consortium and responsibility being to make sure your patient data and other information you need in order to provide good care is protected.
All right, great, thank you. I think one final question. I have people that are interested in this. How do I get them the information to watch this? I think we will email a recording and also post it on our website in a few days. Okay.
All right. Thank you all.
Thank you. So if anybody needs to get in touch with us, here's my contact information, and we look forward to hearing from you. Thank you.